Hey everyone, welcome to today's interview with Vanessa. I love these calls. Vanessa is joining me today. She's going to talk about going through the process herself, how she came to see me for around 6 months and made her successful way through her chronic symptoms. Hey Vanessa.
Hi.
So, how about you describe to us why you came to see me in the first place? What was coming up for you?
Yeah, sure. Um, so shall I talk about what was the run up before I started getting those chronic pain symptoms?
Perfect. Perfect.
Yeah, okay, great. So I'd had a really difficult year with just a lot happening in sort of a span of 12 months. Um, as I was pregnant with my third child and I wasn't very happy at work and then my dad died and there was all this admin stuff and I just did that thing where you keep going and just I should have slowed down, but I didn't, and I just kept going, trying to get through it all. And I thought, oh, I'm handling this really well. And then I had my little girl, and one day after she was born, I was just hit with all of these, um, all of this chronic pain basically just hit me one day after, and um, it wasn't the first time that I'd had this chronic pain. I'd had this happen to me a few years earlier, and had known nothing at the time about that mind body connection, had just assumed that, I had some sort of injury and that it wasn't healing. And it had very, very, very slowly over time ebbed away. So when this came back in the hospital that day, that was so devastating because I couldn't believe that I was, back there again, but also really confusing because this time I had not had an injury or anything like that. So I couldn't understand um, why that was happening. At that point, I didn't understand it. I would later come to understand that there was a lot of stuff that I was carrying around, but right there, I was just so confused. So that's how it started. Um, I then, because it was the second time happening to me, I did go away then and do some research and try and find out a little bit more about chronic pain and why it starts and why it stays. And that's when I learned a bit more about that connection between um your feelings, your emotions, the things that you're carrying around that you haven't really dealt with, and how that can come out in your body. And I decided that I wanted a bit of help with that. So yeah, somewhere along in there, my husband was great. He came across your website, Janty, and you said lots of things that rang true. So I think we got in touch in the summer, and we had a call, and you were just really kind and you listened to me, you heard me out and sort of reassured me. And yeah, and then we decided that we would do some sessions together.
What was the exact pain in the body? What you mentioned it being chronic pain, and you mentioned
Yes.
repeating itself. Where in the body were you experiencing the pain?
Yeah, so I think mine's quite an unusual one because I remember when I did start hearing about chronic pain, it tended to be you'd get sort of like IBS or back pain. Mine was actually like tooth pain, but because this had happened to me already, that had already been dealt with. There just was nothing wrong there anymore, and that's something that can show up on your scans quite easily. And dentists are really great, and mine were really patient, and it had been dealt with. So when this hit me the second time in exactly the same place, exactly the same sensation and the same intensity, and I went back to the dentist, and they, said there's just nothing there. There's nothing wrong. Um, yeah, that's so it was like a throb, an ache. It would sort of move around my jaw and in the back of my teeth and the gums, and it would start as soon as I woke up, or if I was very lucky, I would get maybe 15 or 20 minutes, and then it would kick in, and then it would be there for the whole day, every day. and it wasn't responding to anything. It didn't come on when I ate things or when I brushed or anything. It was just there, like, relentlessly.
Okay, yeah, that was going to be my next question. How is it affecting you throughout the day?
Oh, well, it was just um well, it's so draining. It's just exhausting. You can't get away from it. It's there all the time. For me, it was. It wasn't a case of I've hurt my knee before or I've pulled a muscle in my back, and you can sometimes get a bit of relief if you shift your position around or change things. And I just couldn't get any relief. And it was just always there, and it would move around slightly. Not too much, but it would just travel around. Um, and so I lost my appetite. I would end up taking a lot of naps because that was the only way that I would get any break from the pain would be to fall asleep. I know that's not the case for everybody, but that was it for me. So I would end up sleeping quite a bit. And I just had no desire really to make plans to go out because I'd feel like I needed to perform for people if I was doing that, and I didn't want to. So yeah, it was really, really consuming.
Mhm. And you know, what's interesting, the fact that you'd had the same pain previously,
Yes.
and so how did that pain go away previously then?
Well, basically, I went through a load of unnecessary sort of dental treatment at my request. I will say, the dentists were great with me. They were really patient, and it was one of like my back teeth. And in the end, I said, Just pull it out, please." And they said, "Okay." And once it was gone, I think at that point, I just knew that there was nothing physically that I could do about it anymore. And I just sort of resigned myself to it. And I didn't know anything at the time about that sort of the mind body aspect of it. But I did start to work out by myself slowly that I could get these tiny windows of respite. This was a bit further down the line when I was really engaged with things that I enjoyed. So I
Mm.
started trying to focus on that. Um, and often when I would cry, when it got a bit too much and I'd go upstairs and I'd have a big weep, that I would get a real respite from it then for a little while. Not long, not for ages, but it would like clear something out just temporarily. And so yeah, I just over time it just started to ebb away very slowly. There was never a day where it just changed. I
Mm.
can never quite track it now. But just it did start to seep away very, very slowly. And yeah, in the end, it was just not there. I think because I had stopped monitoring it and thinking about it as much, that gave it some space to go away. But it did take a long time. It did take a long,
Mm.
long time. Whereas I was this time, the second time round, it has been a lot quicker because I
Mm.
think I've known a lot more about it or how to I don't want to say tackle it, but how to look at it or how to approach it maybe.
Mm. Yeah, maybe that first time round, inadvertently you did some mind body work without realizing, going up and having a cry and
Yeah, like
um,
a lot.
so yeah, you
Yeah.
were processing emotions and that was
Yes.
helping, the energy shift, the emotion shift in the way that it needed to. The second time round, like you said, you were a bit more intentional about it, how you were approaching it. You
Yes.
recognized it had some emotional components to it,
Yeah.
so you approached it accordingly. Okay, so second time round, the symptoms come back and they find nothing wrong. They're like, there's nothing wrong.
Yeah.
Did you mention it was a year before you started to consider the mind body approach, or when did you first start to consider
No,
it?
I started to look into it like fairly soon. I'd say a couple of months after this second time. In fact, I think the first way I came into it was via the app Curable.
Yep.
um, which was really lovely. And but to me felt like it was only the beginning. It was a great introduction,
Mm.
and it explained a few things, but not everything. So then I went away and I did some reading. I found some forums, and that there came a point where I remember thinking, I'm really confident that this is the way out for me. I just don't think that I can do it by myself. And I'm sure that for some people, they can, but I felt like I needed some more help, which was then when I wanted to come and look for somebody that could maybe help guide me through it, and who would be patient to answer all my questions, and my, emails. So yeah, so I'd been looking at it for a few months, and then I think I came to you.
Great. So yeah, curable is a great start. I
Yeah,
mean, for a good amount of people, it's wrong to just say it's a start. For a good amount of people, it gets them over the line as well. So
yeah,
really wonderful app. And yes, and then for a handful of us, we need one-on-one support. When I had chronic symptoms, I needed that as well, just
yeah,
to help with all the different tools and the subtleties of what's going on. Okay, so you get to me.
yes,
Obviously, you and I, we started the one-on-one sessions. You were coming quite regularly to the group calls as well.
yes to the meditations as well, wasn't it? Yeah.
Yeah, to the weekly calls. What there's a couple of questions I'd like to ask about the process. Initially, what felt most challenging to you about the process?
So honestly,
Yeah.
um, the the IFS therapy, that idea of having parts of you and trying to, sort of speak to them and acknowledge them, that just did not come very easily to me at first. I was quite, I don't think skeptical is the right word, but um, definitely not um super convinced that that was the right way for me. But open-minded, let's give it a go. Let's see how this works. And we had our first session, and I just remember I think I spent the whole time crying, but in a really cathartic way. And when we had finished, I went to speak to my husband, and he said, how was it? What did you do? And I tried to explain to him, but I wasn't sure I was doing a really good job. But he was great. He listened. He was like, "No, I think that makes so much sense. I think that's exactly right. That there's all these different parts of you that you've pushed to the side when you were so busy. That you had all of this stuff going on that you you've ignored a bit, um, and the fact that you're getting this huge emotional release immediately after it, um says a lot. And I was thinking, okay. And then we carried on, and I just began to look forward to those sessions more and more and more. So I could feel like a shift happening, like something. It's hard to articulate, but I could feel something, uh, like that was really, really tightly wound up inside me, just like breathing. That's maybe the best sort of analogy for it. Like it was just exhaling a little bit, and then there was space for stuff to come out, space that things that I didn't know were going to come out. But yeah, sorry, what was the original start point of that question?
The most challenging thing, and you mentioned
Okay, yes.
IFS
So
therapy.
suspending disbelief about that was part of it.
Yeah.
And I'm just really impatient. So when I didn't get, better immediately, that one was hard. That was hard for me, especially because this was the second time this was happening. I was thinking, but come on, I should be able to to get this done quickly, and it just doesn't work like that. Well, it didn't for me. Yeah,
It doesn't for many of us. It's hard. All of us have been conditioned on this Western medicine
yeah,
approach to healing, which is take this and the thing will go away. And if the thing
yeah,
doesn't go away, then the pill is wrong. Whereas this is like learning a language. It's like learning a skill, and that's very hard to recondition
yes,
themselves to understand healing in that way. We're practicing healing as opposed to getting it immediately after one meditation, and that we need to, learn that. That's tough at first. So I can,
yeah, really hard. Yeah,
yeah, really. And for anyone listening that isn't sure what IFS therapy is, I mean, I have a great, I say great, I have a YouTube video about it, about how IFS therapy helps with chronic pain. It's like an extension of mindfulness meditation. And Vanessa spoke about parts. And the theory is we have parts of the psyche, they're often in conflict with one another. And when we identify them and learn to give them space, you use that word wonderfully, breathing and space, That's what the nervous system needs to regulate. That's what helps the nervous system no longer create pain, tension.
Yeah.
We we give the parts space to express themselves in ways that they hadn't done before. And
Yes.
that at first, the process itself, as you rightly mentioned, you're kind of talking to yourself when you're doing it in the modality.
Yeah.
It's odd, right? It's odd at first.
Yes. Yeah. It doesn't. Yeah. Yeah. It just does. it, Especially it depends as well, how open-minded you are to things. And I would say that I wasn't very. I think have always been quite sort of practical and no nonsense. So you need this, then go and do it. And this just wasn't something I had ever done before. So I was coming at it from a very like mm, place, and it still really surprised me. So I don't think that you have to be somebody who considers themselves really open to that kind of healing for it to work. Because I'd say I wasn't. So yeah.
When I had chronic symptoms, neither was I.
Okay, there you go then.
Yeah, I didn't purposely seek out an IFS therapist when I had chronic symptoms. He was my meditation teacher. It was all an accident.
Right,
So
okay.
I remember we tried it, and I was like, "What is this? What?"
Yeah, and until you've done it a few times, it does. And even after when you're doing it, it's still. I thought your comparison to a language was a really good one. So when you're learning a language, you start to pick up a few words, but you by no means understand the whole conversation yet. That is how it felt like. I would start to understand tiny parts of it, but not all of it in one go. But it just grew over time.
Anyone that starts this process, they know that meditation is something that they're probably going to need to do. A lot of people come to me and they say they just can't meditate, they struggle. IFS therapy really helps with that. It helps you understand what we're trying to do when we go inside. Much of what we're trying
Yeah,
to do is not only acknowledge what's arising for us in the body, but also be okay with the fact that it's going to be chaotic and uncertain. And
yeah,
that's what happens in IFS therapy. That's what happens in meditation, right?
yes. And when we were doing that IFS therapy, which anything that came up, even if it felt random or I don't know what to make of that, you just sort of gently questioned it and then helped to uh, expand it out, and it did lead somewhere most of the time. It would go somewhere, even if it wasn't obvious at the beginning point. Um, but you never, ever, ever made me feel like what are you talking about, which is really important because I think when you have chronic pain and you've spoken to all these different professionals about it, and that they can start to get slightly frustrated with you, you're really looking for someone that's just going to listen to you and let you say whatever it is that's coming up and what's happening, and meet you without judgment. So that was really important as well for me.
It's good to hear that. I laughed at the prospect of me being in a session going, "What?" Like me just going, "What do you mean that's coming up for you?" Yes, we're very much trying to create a space where anything is welcome, and IFS therapy is a great container for that. So I'm really glad to hear that that
Yeah,
really helps support you through that. So, okay, so that was what was challenging for you, and then obviously it became easier, and you began to, really understand the process a bit more. What then would you say was, I don't know if helpful is the right word here, throughout the process? What was something that you really were like, okay, I really liked doing this outside of sessions? Obviously it's always meditation and journaling that we speak about. Perhaps it was one of those or both of those, or perhaps it was an approach to life that we would speak about. Was there something in particular in the process you'd say was very helpful?
sorry, it just froze for me there. Yes, I'm so sorry. That just froze slightly. Did you say it was the question, what was helpful for me
Yes.
outside of
Outside of
sessions?
sessions, what would you say was the most, you could say in sessions and outside of sessions, what was the most helpful thing for you?
Okay. Um, so first of all, hearing other people's success stories was really, really helpful for me. They made me feel hopeful. Um, they would boost me when I was having a particularly tough time. I found those just because they're from real people who I think have no other incentive to share their story other than they've been through it, and so they know how you're feeling. So I found those really, really helpful. I know this isn't quite the same type of answer, but things that you enjoy. Um, I'm going to say authentically. Just what I mean by that is sometimes there's pressure to go out and be with people or take a walk because we know that those things are supposed to be good for you. But if you don't really want to do them, then I'm not sure how helpful they are for you in the moment. So for me, I love to read, and I would find that if I could just get a bit of time to go away and do some reading, that was really like restorative for me. You know, you talk about your nervous system being um well, I felt like mine was hypervigilant, and so doing those things that did bring me, quiet joy, I feel contributed to soothing it over time. Um, and I know you've already said journaling, but for me, that I think was the biggest game changer. For me,
Mm.
that was, yeah,
Hmm. So great. Yeah, no. So listening to success stories,
yes,
being authentic to what you wanted to do, which for you was finding time to read, and
yes,
the journaling as well.
yes, and and anything, whether that was in success stories or podcasts or articles or talking to you, anything that made me feel like it was okay to, um, how do I say this? Take a break almost. You feel guilty when you have chronic pain, like all the time, about who you think you're letting down, whether it's your family, whether it's your work, your friends, whatever. Um, and once I'd managed to shift away from that and feel okay in saying, oh, not today, or no, thank you, or maybe another time, that was huge for me as well because I removed this external pressure, and I think again that was soothing. And so it meant when I did go and do those things, or I was there, I was a lot more present, and then I felt good about them. I didn't come away thinking, oh, yeah, Portia, or I've not done a good enough job there. Does that make sense?
It does, yeah, and I'm really happy that you mentioned that. I mean, the vast majority of people come to me, they have young families, elderly parents, maybe full-time job. It's just, a lot on. So,
Yeah.
so guilt is a common theme. Like just feeling guilty that they can't be the best version of themselves in all those, scenarios.
Yes. And I remember listening to I can't remember who it was now, but somebody was talking about chronic pain, and they said that when you have chronic pain, it doesn't turn you into, a very good version of yourself. And like, well, it's not going to, is it? It's really difficult. But I don't think you can berate yourself on top of that. I think you need to be really generous with yourself, the way that you would to anyone else that you knew was having a tough time. It's a bit harder to do that for yourself, I think. But yeah, in my case, I had three children, and I was going for naps in the day when it was at its worst. And um, I was really lucky to have, a partner that never made me feel bad about doing that, but I felt bad about it. And it took a while before I started to believe that no, I'm doing this because it's helpful to me, which in turn will make me more present and more relaxed when I come back out with everyone. Yeah, does that make sense?
It does, yeah. And I mean, it's three kids, job. It's a lot. So
Yeah, it's a
it's yeah,
lot. Three
it's
kids
a
is
lot.
wild.
Yeah. So it's any wonder, of course, this part of you would come up and feel guilty, and then to give parts of you permission to really focus on yourself.
Yeah,
That's
that's hard. That
hard.
doesn't, yeah, that doesn't, I don't think, come naturally. And so you're already feeling rubbish, and then you're piling on some sort of guilt and shame about feeling rubbish. And it's not your fault. Yeah, it's just not your fault that those things are happening to you. So, uh, like, please just give yourself permission to take breaks whenever you can. It's really okay. Yeah.
And I can recall, I mean, not specifically, not to get into specifics, but that guilty part coming up for you in sessions and us, communicating to it and validating it,
Yeah.
letting it know we understand why it's there. And sometimes people they'll hear, just forgive yourself, take the pressure off, and yet they still just can't just yet. So they
No.
maybe need to do a bit of work with that guilty part of them. That's where something like IFS therapy can come in, or journaling, or something
Yes.
like that, to make that
Yeah.
transition. So, okay, so these things were helpful for you. It's so interesting. People, whenever I ask what was helpful for them, I mean, it's always journaling or meditation, but it's so interesting to hear like it's never this exactly the same thing for everyone.
No.
Yeah, it's really interesting. And there's some practitioners now that are saying the only way to get better is meditation. You've got to be in the body, journaling is going to be too intellectual. But time and time again, I hear, no, journaling was the turning point for them.
It was for me, and I think um, I don't think there's just one straight pathway to dealing with your chronic pain symptoms. I think there's various routes there. They're all sort of in the same, in that mind body field, but you'll have to figure out the ones that are working for you, and that takes time, and did for me, or the ones that some of them you have to work at a bit harder, don't get me wrong. Um, but yeah, I think you might hear, like you said, that for one person, this was the specific sort of breakthrough point, and it might not be that that feels the same for you, and I think that's okay. I think you'll find the route there. You've just got to give it time and just got to practice, and you'll find your way through eventually. So I would not love there to be a one restrictive way of dealing with your chronic pain. I don't think that that's personally right. I think that there's different, yeah, ways there.
Yeah, there's not multiple truths can coexist, you know.
Yes.
Truth, thankfully, in any of these containers, we try and include as many of those multiple truths as possible to give people those
Yeah.
options. You mentioned two really important things. You mentioned sticking with it and time. So you mentioned
Yes.
consistency and you mentioned giving it time. Two things that maybe in the midst of it are kind of tricky. And
Yes.
for many of us in this process, it won't be like we just gradually get better and that's how it goes.
No.
This, isn't it?
I literally have an image saved on my phone from last year where I near the beginning of last year where I was having a tough time. And it is that diagram of about progress is just not linear. And you can come back down into a real low point, but you will come back out of it, even if it just doesn't feel like that when you're in it, when you're in that hole. But yeah, it does. It does take a long time. In my case, it was absolutely not like that. It was up, down, up, down, up, down. For example, at one point, my symptoms disappeared for a couple of weeks only to come back on the opposite side. Uh, and I knew that there was nothing wrong, but didn't make them go away because I wasn't quite there yet. But that was really frustrating because that felt like I was sort of tackling the same problem, but not because it was on a different side. So it's ups and downs, definitely. But time, oh, I remember because it was the second time happening to me, I was so frustrated that I wasn't getting better quickly. And sometimes I would hear success stories and people got better, and I had been going with this longer, and I was thinking, oh, but I just think everyone's timeline is different. I remember hearing that and being really frustrated about it. But honestly, that feels like the biggest truth that I've found, that your timeline is not comparable to other people's. You've got different things happening in your life. You've got different things that contributed to this as well. You just have to be patient, slowly. And it's not a case of going at it harder. In fact, sometimes that creates this pressure because we are used to that, aren't we? If you want to get better at something, practice more and more and more and more. I think definitely keep up practice consistently, but you just don't put that pressure on to try and do too much. Like take a little break for a while, come back, take a little break, come back, that kind of thing. Just be patient if you can.
I'm happy you mentioned that because my next question was going to be about you mentioned it being a hole. It's often
Mhm.
called a relapse. What was it that helped you in those moments? And you answered the question a bit there. You were like, you don't have to do more of it. Some people in those moments, it's not that they do more of it. Some people try, they do less. They just end up doing nothing. So what really helped you then in those moments, if you can recall?
Yeah, no, I can. So at the beginning, I had tried to track my pain, a bit obsessively to see if I could. It's that need to understand it and to find patterns in it and whatnot. And I had stopped doing that after a while. But whenever I managed to get s- small breaks from it, because that's how it started for me. It was, I said at the beginning, it was there every day, every hour. But over time, when, especially as we had started doing some work, I would start to get some breaks from it. You know, they weren't long ones, but sometimes I'd get an hour or two in the day where there was no pain. Best hour ever. Um, and so I would, when I was having those flare-ups or I was relapsing, I would try and remind myself that my body had already given me proof that this could let up for me, and it would come. If it happened once, it would come back round again, and I just needed to wait. I just needed to be patient, and I would reach for anything that was a bit of a coping strategy in that moment. And I think that's that thing about being generous to yourself with what you need. So if I needed, I would read a bit more. I would go back to the stories. I would read things that would remind me that this was a long time process. And I would journal, not obsessively, just in the moment. I would do a big cry. And I I remember going having a big cry and thinking, oh, I thought I was getting better and I'm not. I'm back here crying. Uh, but no, it's not like that. It's not about reaching a point where you're never journaling or never crying anymore. That's going to crop up for you. Um, just yeah, yeah. Does that kind of answer it?
Yeah.
Maybe. Yeah. Is that
I
all
mean,
right?
it's your answer. Yeah, I know
Yeah.
in those moments, sometimes we'd have some exchange on emails as well.
Yeah. I would say I would email you and I would say I don't understand why this is back. Um, but I think yeah, remembering that it had gone away for a little bit, finding those things that I enjoyed journaling, letting myself be upset, talking to trusted people about it, so you, but also, in my own circle, um, and like giving myself permission to withdraw for a little bit if I needed to, just
Mhm.
to have some time on my own, 'cause that works for me. So yeah,
It's really important that you say that last bit that it works for you because those relapse moments, they are a part of the process. They're an important part of the process. It's almost like
yeah,
the mind and body is testing our capacity to stay with whatever it is that needs to arise for us in that moment. And for you to have understood that you needed to create a unique version of moving through that part of the process is really
yeah,
important. Because again, it won't look the same for everyone. For other people,
yes,
yeah, it's going to be something different, a bit different that
yeah,
moment. So to be able to curate something that just worked for you was, something really important that we were able to offer for you. And yeah, reflecting on that now, you can see how important that was.
yeah, definitely. Um, and so yeah, so what happened then for me was, um, it I just carried on using those tools that you had shown me, carried on trying to be patient, waiting, and all of a sudden was getting days that I had no pain, and then it would come back, and then I've got these little landmark moments. I remember going to my cousin's wedding and having such a great time, not thinking about pain at all because it just wasn't there, coming out of that and having a full week where it was like I was like the old me, and then it came back. But it just grew over time. More good moments kept coming. The pain flare-ups became less frequent and less long. I remember you saying that because I think I asked you once, I said, do you still get pain flare-ups? And you said, yeah, sometimes. And I said, do you not panic about that? And you said, no, because I know that it will go and I know that it means I need to do some work. And then once I've done that, it'll be fine. And that is precisely the point that I've reached now. I just they're so far and few between, they're barely there. When they are, it's like it's a flare that comes. It lasts for maybe an hour. I'll sit down, I'll still do journaling, or I'll think about it, or I'll wonder if I've pushed myself too far recently. And then it goes, and I just don't give it any more thought beyond that. And I never, ever, ever thought that I would reach this point. That just felt completely impossible for someone that was spending, you know, all of their waking day in pain to now just not having it. So, yeah,
It's such a beautiful insight that you managed to have, which was that you redefine what normal was, because a lot of people perhaps they'd listen to this and the prospect of still having a symptom every now and then in life is so daunting because
Yeah.
when you go through chronic symptoms, when you're in the midst of it, normal to you is never ever having anything ever again.
Yes, but yeah, but I don't think that's true though. It's just that we
Well,
don't focus on those other pains either. So if your, if, for example, if your chronic pain is not migraines or not headaches, everybody gets a headache occasionally and they don't overthink it, do they? Or vice versa, if yours is not IBS, everyone gets some tummy pain sometime and they don't pay it much attention and it goes and it's not a life ruiner at all. But your chronic pain is like it really does ruin your life for a while. Um, but eventually it sort of fades back into one of those normal pains, just like all the other ones, except that you know now that it probably signifies something emotional for you. So you just give it a little bit more attention, a little bit more thought. But I just, I was so, so low. I was so sad and I felt like I just wouldn't get my life back. And, I, I completely have. It's not like a partial thing. I am just, so happy again. And everything is not everything, but, things are really good for me. And there's nothing that I can't access or can't enjoy now when there was so little that I could, you know, a year and a half ago. So, yeah.
which answers the question I was going to ask
Oh,
next.
sorry.
No, you're
Just
good.
jumping ahead.
You're
Sorry.
right ahead. No, it's perfect. The conversation is flowing naturally, which was, yeah, where are you at now? You're in a great place, and pain has subsided in the way that you needed it to, and you're, back to your life and then some.
Yeah. Yeah.
Mm.
And you don't always have to find, sort of a deeper meaning from suffering. I know that that's sometimes that's helpful to think that if you go through this hard time, it will propel you into something else. But I will say that like the joy that I feel is almost like extra because I can still remember what it's like not to have that joy. And so my joyful moments now are really, really joyful, and I have a lot of them. So yeah, it's weird. It's really weird. It's like the worst time of your life, but once you come out of it on the other side, you can't. I don't know if I look at it like that anymore. I just, it absolutely was when I was in it. Um, but maybe it's just because I'm not afraid of it anymore. That's the big one, and that takes a long time to stop being afraid. But now I'm not. So yeah, so it can come sort of like knocking for a little while, and it's not a big deal.
Yeah, on the other side of it, we all look back and we go, okay, that was difficult, challenging, horrible. I wish it on no one, but it was also very significant for me.
Yeah, it's hugely significant and it'll teach you things about you and also some of the stuff that I started doing during that time I've still held on to. So I am much better now at knowing my limits, knowing when I don't want to do something. I'm not talking about my responsibilities. I'm just talking about, I've seen enough friends this week and I need some time for me. I don't feel like I have to meet other people's needs as much as maybe I used to. So
Mm.
that's something that I'm not sure I did before. It's probably part of the problem. And now I do, and or I'll say, yeah, sure, but maybe next week, or I've got a lot on this week, so could we just push it over? And I've become really comfortable at saying that, which is good.
So yeah, so the process, well, I say the process, but just having symptoms, as difficult as it was, it taught you, I don't know if boundaries is the correct word, but it just taught
Yes,
you
yes,
to self-care more. Yeah.
yeah, boundaries definitely, and that was no one else's fault. It wasn't that they were encroaching; it was that I just didn't, make them clear. So that's not on them. That was on me. Um, and now I have them, and people are great. Like, what if you have your boundaries there? Most people are pretty good at respecting them. They just need to know what they are. So, yeah, I've still got all my friends. They're all brilliant, and they're fine when I just say, no, I've had a bit of a week with the kids, or work was a bit full on, or yada yada yada. Do you mind if we don't? Yep, that's fine, no problem. And then I don't overextend myself anywhere near as much as I used to. Yeah.
Mhm. So overextending yourself was one of the main lessons, right? Just to
Yes. Yes, and sorry, can I just squeeze one more in there? I
Of
don't know if
course.
this is
Yeah.
just n not relevant for everyone, but there's I think we all feel that pressure to be thought of in a certain way. We've all got, what we think of our as like our identity. Um, and trying to live up to that sometimes is just creating a pressure that you don't need. And I have become really good at not over explaining myself to people now. I used to feel like I had to offer a justification or a clear explanation for not wanting to do something or for wanting to do it my way. And I just don't now. And that there's something really freeing about not seeking somebody else's approval if it doesn't, if it's not about them, if it's about me and my life and it doesn't impact you, I don't need to explain that in depth. It is enough to just say, oh, no, thank you. Or, yeah, maybe another time. That for me was a big one because I always used to try and manage other people's feelings. And it's not about being unkind or selfish, but to not have to justify yourself all the time. That's a big one for me now.
I'm really glad that you chose to share that. So many people, I don't know if it's fair to say people pleaser traits for you specifically, but a lot of people, they come into this as people pleasers, as perfectionists, people that like to be in
Yeah.
control, people that like to plan. So
Yes, that's me. Yep.
yeah, so you mentioning it and realizing, the other side that you've gotten to is so significant for anyone that is working their way through this process as well, that you can get to a place where you're able to, like you said, set boundaries, not in
Yeah.
an unkind way, but in a way where you just really understand what you need and what you don't need. And people usually respect that. I mean, if they don't, then maybe they
Well,
shouldn't be in your life.
y-
Yeah.
exactly, exactly. But I would say that most people do. Yeah, that's been my experience, which is nice. But yeah, you're right. If they don't, then just let them, go away and then come back when they can. So yeah.
My final question always is about any advice that you would give for anyone.
I think I've mentioned it before, but just be patient with yourself. Just don't compare your healing timeline to somebody else's. They're not the same. They can't be the same. And I really, really, really believe that everybody can come out of this the other side if they just give it enough time and put do the work. Just do it, but do it gently. Don't don't pressure yourself with it. But just do it gently and consistently. And I'm really, really confident that things will get better because they have for me, like so categorically. So yeah.
Well, thanks for sharing, Vanessa. Really
Oh, that's
lovely way,
okay.
really lovely way to end it. Was there anything else you wanted to share or add before we end?
Um, no, I don't think so. Just yeah, thanks for everything, Jonty.
That's all right.
It was great. Oh yes, maybe the last one is that you and I finished our sessions just under a year ago, and it took me this long to come back to you to be able to say this, I think, really confidently that how much things had improved because I didn't want to rush it. Even I've had good stretches for ages now, but there was always that maybe that fear or that anxiety that it wasn't quite real or that it wasn't quite long lasting. And I felt so good for so long that that's why I wanted to come back and say it. So, um, yeah, just it took me time. So yeah, that's it really.
Well, thanks very much for agreeing to do this. I'm sure it's going to be very helpful for anyone watching, in the same way that you listening to other people's success stories helped you. So,
I
yeah,
hope
really,
so.
really, yeah, really grateful for you for
Oh,
being
no
in touch.
problem. No, it's nice to it's unbelievably nice to be the one in the position now to be able to say that because it just felt like that would never be me. So yeah, absolutely no problem.
Thanks, Vanessa. So, so thanks everyone for watching. And anything else you would like, any questions you have, you can always ask at the bottom of this YouTube. But thank you very much. Bye, Vanessa.
Bye.